Lower back pain is extremely common. About 40% of adults have back pain every year. If it's not you, you probably know somebody, whether it's in your family or your close friend group, that has recently dealt with a bout of lower back pain. For many, back pain is an easily treatable and preventable issue. How can we easily treat it? That's what we're talking about in this video. Sadly, once we reach our 30s, our bodies start the aging process. I mean, I'm not that old yet, but I have heard that from people who are that old. Our muscles start to shrink and we begin losing strength. We lose about 3 to 5% of our muscle and 3 to 12% of our strength per decade. What does this have to do with lower back pain? Our lower back muscles and the surrounding muscles are not exceptions to the aging process. They will also lose strength and size with age. As our muscles weaken, our spine alignment worsens, movement becomes more restricted, and our back becomes less capable of handling the daily activities that we do. For example, if your back is weaker, you might feel more pain when you're carrying groceries, moving furniture, or lifting luggage into the overhead compartment. Weakness is not the only cause of back pain though. There are many causes, such as trauma, lots of time spent sitting, and obesity. Strengthening your lower back could reduce the chances of you suffering some injury. It can also increase blood flow into the surrounding areas, improve your spinal stability, reduce pain, and make your back more capable of handling those daily tasks. Let's dive into some solutions, both ineffective and effective options. One common piece of advice that I'm guessing you've either given or received before is that when we have back pain, we should take it easy. The underlying message is that if we don't use our back while we're having pain, that the pain will just subside and go away. This is good advice for a recent injury. If you've had back pain for a while, taking it easy might actually be bad advice. When it comes to lower back pain, doing something is typically better than doing nothing. A recent meta-analysis proved this. A meta-analysis, by the way, is a study that combines the results of all these other studies into one overall result. In this analysis, the researchers combined the data of 75 studies and over 5,000 people. All of these studies experiment with using some kind of exercise compared to rest for people with lower back pain. The main result was that the people who performed some kind of activity were better off for reducing their back pain and improving their functional ability compared to people who did nothing. The activities, the something, range from yoga to Pilates to core stabilization exercises and stretching. Rest is a good approach for a recent injury. However, for chronic pain, rest is a bad idea. Whether you're injured or in pain, resting can lead to what's known as deconditioning syndrome. Deconditioning syndrome is when you are resting the muscles in an area with pain. And what happens is that as you rest more, you actually lose strength and lose muscle, and this leads to even more pain, which leads to even more rest. And then you continue that cycle where you're continuing to make the pain worse and you're losing strength in the areas around that pain. When it comes to lower back pain, what can help the most? Core training has become a popular approach for those with lower back pain. The core refers to all these muscles in the midsection, including muscles that are very deep. While this approach has value, there is a better approach. Directly strengthen your lower back muscles. Directly strengthening your lower back muscles leads to a number of benefits that could be useful to you if you have lower back pain. First, it can reduce or eliminate the pain itself. It can strengthen your lower back muscles. It can reduce injury risk, and it can enhance the bone density in your lumbar spine. My personal experience supports this, both for myself and when training former personal training clients who are suffering from back pain. I had back pain off and on for years until I started strength training my lower back every week. As a personal trainer, I've used a small amount of weekly back extension exercise with over 100 people who had lower back pain. In most cases, the back pain reduced or completely subsided. Let's talk about how we can train our lower back. A back extension can be performed in a few ways. I recommend that you use either a lower back machine or a Roman chair. Perform at least one set per week, which has been proven to be an effective volume for achieving the benefits that I just mentioned. Choose a weight that's challenging and perform as many reps as possible with good form. Just as you would with any exercise, increase the resistance at least every few weeks to make sure that you're continuing to get stronger. You can perform more than one set per week. Add a second or third set per workout if you want to build more strength and more muscle in your lower back. At most, I recommend doing this exercise twice per week. Before I wrap this up, I want to offer one note of caution. Not all lower back pain is the same. If you have degenerative disc disease, spinal stenosis, a fused lumbar spine, do not follow any of the advice in this video. These are conditions where attempting to strengthen your spine could actually make pain and functionality worse. This approach may also not work for those with sciatica, who, if this is you, you'd probably be better off with physical therapy. For all other lower back conditions, directly strengthening your lower back could reduce pain, improve movement, and enhance your overall quality of life. I'm Dr. Preuss. Thanks for watching this video.